As we speak, the Chief Medical Officer who briefed me earlier today is conducting leading the AHPPC, or Australian Health Protection Principal Committee, with Chief Medical Officers and Chief Health Officers from all states and territories. And importantly though, the message that Queensland has given is one that I would re-emphasise as well. Vaccinations are considered a critical reason to leave home. We would encourage all patients, subject to checking with their doctors, to continue with their vaccination program. So if you are in the Brisbane area, please continue with your vaccination program, subject to your practice being in a position to do so. And we understand that that is the case, and if there were any interruptions, we'd provide that advice. At this stage, as we speak, I haven't received any information. I think it's very important to put this in context. We know how to do this. Australia has had 53 days with 0 cases this year already. We know that around the world we are at almost 500,000 cases a day after having seen a peak and then a dip over much of the last 2 months. We're now seeing global cases rise again, particularly in Europe and Eastern Europe. And so this pandemic around the world at approximately 500,000 cases a day continues to provide a global challenge on a scale we have not seen since the Second World War. And so against that background, the continued rollout adds to the protections. We know how to protect ourselves and to contain, but we can only be fully protected once we're vaccinated, but also once the world is vaccinated. So it's a two-part process, at home and abroad. On that front, I can advise that there have been 82,500 aged care residents who have now been vaccinated, and that covers over 795 facilities that have received first doses and 222 that have received a second dose. Importantly, to re-emphasise, our total national vaccinations, 541,761, and over 259,000 vaccinations in the last week as we have brought on board the general practice program. So I think that's extremely important, and that's indicating that this program is continuing to accelerate, as it will this week. To provide more information, I'll invite Dr. Lucas Totoka. Lucas is a public health expert who has been leading the program for general practices and helped co-design with the AMA and the College of GPs, the College of Rural and Remote Medicine and Rural Doctors Association of Australia, as well as numerous GP webinars. And what we see here at Bluff Road is what's happening around the country. Different practices are using different models, but Nick, your approach, I think, has been exemplary, and they chose to do a block vaccination model over the course of the weekend. Others will do it on a more regular basis during the week, but 241 vaccinations already, more to go, and they'll just keep going throughout the course of the coming months.